Hello. We'll continue our lectures about urine analysis, preservation, and timing. There are several chemical preservatives that can be added to the routine urine analysis specimen, but most of them interfere in some way with the testing procedures. For this reason, the routine use of preservative is not recommended. That means you need to analyze it fresh. Preservatives which can be used for the random sample include refrigeration up to 8 hours in a maximum 6 degree Celsius. Toluene used if only chemical contents of urine are of interest. It lies on the surface of the urine, the toluene, forming a thin layer and acting as a physical barrier to air and bacteria. 10% formalin, excellent preservative for microscopic elements in urine. 8% boric acid, used for general purposes. It will not interfere with examination for protein, sugar, or ketone bodies. Chloroform interferes with some chemical tests and cause cellular changes. Sodium carbonate to preserve urine in urine. Abnormal urine constituents include proteinuria, which is the presence of abnormal amounts of protein in urine, gives a foamy urine. The presence of increased amount of protein in the urine can be an important indicator of renal disease. It may be the first sign of serious problem and may appear long before other clinical symptoms. Urine of healthy individual contain no protein due to the low molecular weight protein is reabsorbed by the glomerulus, while the large molecular weight protein cannot pass through the kidney tubules to urine unless kidney tubules are damaged. Associated with face or feet abnormal edema due to this proteinuria is always associated with face or feet abnormal edema due to the disturbance of liquid balance in body due to protein loss. The main protein in urine is albumin, therefore proteinuria can be called albuminuria. Microalbuminuria is the presence of a small amount of albumin in urine. It is very important in detection of early stages of nephropathy. The detection. Most assays are performed on urine samples up till 24 hours. The qualitative test using reagent test strip, while the quantitative depends on the volume and time of urine. The reference value, you don't need to memorize the reference value. For 24 hours, are the reference value. The qualitative reference value, either the normal value is a negative. Benz-Jones protein. Benz-Jones protein consists of dimers of light chains from immunoglobulins. It precipitates when heating to up till 60 degrees centigrade, but becomes soluble again when boiled. These are low molecular weight proteins, around 44,000 Dalton, easily filtered through healthy glomerulus. Protein appears in case of albumin or globulin due to glomerular permeability disease, hemoglobin due to urinary tract lesions and glomerulonephritis, myoglobin due to damage in muscle tissue, Benz-Jones proteins due to multiple myelomas, false protein due to urine mixed with semen, temporary. The proteins can appear temporary due to pregnancy or fever or severe exercise. This table shows the relationship between the GFR categories, either G1, G2, G3, G4, and this is the cases of the glomerular filtration rate, in relation to the present proteinuria or albuminuria categories, description, and range. And you can see how severe when it is the increased risk when it's red. So this only table for knowledge, you don't need to study these tables. The second case of abnormality is glucosuria or glycosuria. It is the presence of significant amount of glucose in the urine. Normally glucose is reabsorbed by active transport in proximal tubules and therefore doesn't appear in urine. If the blood sugar level exceeds the reabsorption capacity of the kidney, the renal threshold, glucose will appear in the urine. The quantity of glucose that appear in urine is dependent upon 1. Blood glucose level, 2. Rate of glomerular filtration, and 3. The degree of tubular reabsorption. Usually glucose will not be present in the urine until the blood level exceeds 160 to 180 milligram per deciliter, which is the normal renal threshold for glucose. Other sugar may be present in urine, like these sugars, lactose, fructose, maltose, and mannose. Glucosuria appear physiologically in case of alimentary due to high carbohydrate-rich diet, gestational diabetes due to pregnancy, and distress due to increase of adrenaline. Glucosuria appear in case of disease like diabetes mellitus, pancreatic disease, and renal glucosuria. False negative result due to high ascorbic acid and uric acid. False positive result due to high level of ketones and in patient taking levodopa. It's a drug used to treat Parkinson's symptoms. If we look to the third abnormality is ketonuria, which is the presence of abnormal amount of ketone bodies in urine. Body normally use carbohydrates as source of energy. If carbohydrate source depleted or there is a defect in the carbohydrate metabolism, body uses fat as a source of energy. One of the intermediate product of fatty acid breakdown is acetyl coenzyme A. Acetyl coenzyme A, of course, enters Krebs cycles if fat and carbohydrates degradation are balanced. When acetyl coenzyme A cannot enter Krebs cycle, it is diverted to form ketone bodies. Three ketone bodies are formed, either acetone, acetoacetate, beta-hydroxybutyric acid. The increased ketone bodies in blood is ketonemia. The increased ketone bodies in urine is ketonuria. The increased ketone bodies in blood and urine is ketosis. Normally, ketonuria will occur before ketonemia. The normal values, negative test result if normal. These ranges you don't need to study. The results are affected by diet and drugs. Ketosis appear in case of decreased intake of carbohydrates like starvation, decreased utilization of carbohydrates like in case of diabetes mellitus, digestive disturbance, dietary imbalance, and prolonged vomiting and diarrhea. Ketonuria appear in case severe uncontrolled diabetes mellitus, unbalanced diet rich in fat, prolonged starvation due to gluconeogenesis. Causes of false positive ketone on urine analysis due to the low urine pH or increased urine SG, specific gravity. We'll talk later about SG, and phenolphthalein, the active ingredient in laxative, can lead to, if we take laxative, it can give a false positive, and levodopa, the drug used for Parkinson's symptoms. The fourth type of abnormality is hematuria. It is the presence of red blood cells in the urine, cannot detected by the naked eye, so detection by strip or microscope. You can see the strip in the third figure. The positive result may be due to this case is no pathological cause, or abnormally due to the stones or tumors. Other confirmatory tests is needed. So you can see in the second figure the difference between urine that have blood cells and normal urine. The fifth abnormality is bilirubin and urobilinogen. Bilirubin is formed from the breakdown of hemoglobin in reticuloendothelial system. The free or unconjugated bilirubin is insoluble in water and cannot be filtered through the glomerulus. In liver, bilirubin is conjugated with chlorochloronic acid to form bilirubin diglucuronide. It is easily filtered through glomerulus and excreted in urine whenever plasma level is increased. Normally, no bilirubin can be found in the urine. In intestine, bacterial enzyme convert bilirubin into urobilinogen. A small amount of this urobilinogen is also excreted by kidney into urine with a normal level of 1 to 4 mg per 24 hours. When the level of the total bilirubin exceeds 2.5 mg per deciliter, the tissue of the body take on the yellow color of bilirubin, and this is called jaundice, saffra. If the jaundice is due to an increased unconjugated bilirubin, no bilirubin will be excreted in urine because this unconjugated bilirubin cannot be filtered at glomerulus. But if jaundice is due to an increase in conjugated bilirubin, the bilirubin will be present in the urine. There are three major types of jaundice, either hepatic, obstructive, or hemolytic. And you can see from this figure how the conversion of the bilirubin and the unconjugated bilirubin, the conversion between the unconjugated bilirubin into conjugated bilirubin occur in the hepatocyte, in the liver, coming from the blood and then to the small intestine. And it can be the urobilinogen, can be either excreted in the kidney or the urobilinogen either excreted in the feces. 90% are excreted in the feces. The sixth abnormality is hemoglobinuria. It is the presence, as you can see from the figure, it is the presence of hemoglobin in urine due to rupturing of RBCs, occur in malaria, typhoid, and yellow fever, and hemolytic jaundice, and other diseases. Nitrite. The nitrite is used for screening for bacteria. Normal urine contains nitrate but doesn't contain nitrites. In presence of bacteria, the normally present nitrate in urine is reduced to nitrite in presence of bacteria. So this gives a positive test. Pink color indicates the presence of more than 10 organisms per ml. The pH. Phosphate will precipitate in alkaline urine. Uric acid will precipitate in acidic urine. So that means you need to test if its urine is alkaline or acidic. SG, it's a convenient index of urine concentration. It measures density and is only approximate guide of true concentration. Knowing SG, specific gravity, will allow determination of fluids characteristics compared to standard, usually water, at a specified temperature. High SG is due to protein, glucose, and other substance. The normal range for random specimen, you don't need to memorize the normal range. There is two cases, either hypo or hyperthinuria. That means the hypo and the hyper when the urine with a low specific gravity, and the other is the hyper is when it's above the specific gravity. The equation is important for SG. It's the weight of the volume of the urine over the weight of the same volume of water. You can see here the device which measures SG. The specific gravity of urine can be measured by a device called refractometry. And you can see refractometry, it is reading of a urine specific gravity of this reading is around 1.024. SG measurement is taken by reading the boundary line between the dark and light regions, as you can see from the second figure, the dark and light region, the boundary line between the dark and light fields against the graduation on the left column of the graduation. The reasons of high SG due to diabetes mellitus, presence of glucose, protein, adrenal insufficiency, presence of X-ray exposure, use of IVs, dehydrating illness, fever, sweat, vomit, diarrhea. The reasons of low SG, large intake of fluids, use of diuretics, diabetes insipidus, or renal disease and damage. Here you can see a simple comparison between diabetes mellitus and diabetes insipidus. It's a good comparison to see how you compare between the characterizations of each type of disease and what is the constituent of the urine.